I'm Dr. Shanthala, Chief Gynaecologist, Sagar Hospital, Kumaraswamy Layout. Safe abortion. Abortion, is it safe? Yes. Abortion, if performed in a registered center under the supervision of a gynecologist who is well trained with performing abortions, it is safe. To what extent it is safe? When a woman gets pregnant due to various causes, it may be a rape, it may be unmarried who are in a live-in relationship and they conceive, they don't want the pregnancy, or due to various social causes, we can perform abortion. Who can provide the abortion? Ideally, a gynecologist has to provide this abortion, and who has the province to take the abortion. That also to be chosen according to the circumstances and where and what. Lot of laws and regulations are made by the government to make abortion safe in the country. What happens if the abortions are not safe? If the abortions are not safely performed, the mortality rate of a girl child or a woman is 9% in India, because due to various causes, women having not literated or not educated go to illegal abortions, which happens in the rural side. Many because of the rape or because of the society, they don't want to make this pregnancy an obvious, so they go for illegal abortions. There they use herbs and sticks which can cause injury to the uterus and damage the genital tract and cause lot of damage and future fertility problems to a girl child. Many times they can land up in septic abortions and they become serious, admitted in ICU, and so many people die because of the unsafe abortions. So I feel nowadays abortions have become very common. We are getting on counter also tablets. In my practice, many doctors or friends or who are working in the pharmacy company also recommend the MTP pills, but they don't know how to use. Girls, they go to the medical store and on counter they buy this MTP pill, this they consume and they come back to us with a retained products of conception and continuous bleeding for a month. So I feel medical abortions are permitted up to 7-8 weeks. After that, we have a surgical evacuation. The first 3 months is safe for any woman to undergo abortion, but the second trimester abortion, that is in the month of 4th, 5th, and 6th, is little risky and dangerous. It can cause immense bleeding if they take at home the tablets, and they will collapse with low blood pressure and they have to be taken to the hospital immediately. So as per our Supreme Court decision, up to 24 weeks we can terminate the pregnancy as per the requirement of a woman. So many fetus or babies in the womb who are defective and they are having a multiple defects, developmental defects, also can be removed from the womb by safe practice of abortion by the gynecologist. As per the Supreme Court, a baby which is affected with the Down syndrome is not designated for abortion. Again, it is purely the choice of parents, but any doctor performing the abortions for the Down syndrome are not going to be spared. So I feel abortion should be safely practiced for the health of a woman in the future and for also the future conceptions, because this can cause genital tract injury, tubal blocks, infertility issues, recurrent pregnancy losses because of repeated abortions, and cervical incompetence. That is, the cervical mouth becomes very loose and there will be repeated abortions and lot of infections. So these are the problems which has to be taken care when anybody wants to go for abortion. At the same time, the providers also must be trained in a good center. So as of now, in our hospital, we have all the facility with a registered center with a good practitioner, gynecologist, to perform this safely. Thank you.